This is my intradermal video. I would begin by knowing my 6 rights of safe medication administration, which include right patient, right time, right route, right medication, right dose, and right documentation. Always perform hand hygiene, so I'm washing my hands. I'm going to check the MAR and the doctor's orders, and it looks like my patient is to receive 0.1 milliliters of Mentox, which for a tuberculosis test. So I will gather my medication. I'm going to push this down. Remove the cap and clean the top with an alcohol swab. Then I will take my needle, remove it from the packaging, and carefully remove the cap. Oh, I gotta take it out of here first. Carefully remove the cap. Draw up my 0.1 milliliters of just air to be inserted into the vial, being sure not to touch any sides with the needle at a 90-degree angle, and I will insert the air into the vial, tip the vial upside down, holding it carefully at a 90-degree angle, and draw up my medication, being sure to remove any bubbles that may have gathered. So I need 0.1, and I can tap it to make sure all the bubbles are out. Setting the vial down, carefully removing. And to recap, I'm going to use the scoop method with one hand downward and scooping and carefully replacing the cap. After the procedure, I won't recap my needle before I dispose of it unless I have to cross the room to reach the sharp spin. So now I'm going to walk over to my patient's room. Hi, my name is Maddie. I'm going to be your nurse today. Can you tell me your name and date of birth? And the patient will tell me their name and date of birth. And then I will also check the patient's wristband so that I have 2 identifiers. Wash my hands. And then I'm going to put on some gloves and explain to the patient that we're going to be doing an injection for a tuberculosis test. I would also check the patient's allergies, which my patient is allergic to Celebrex. So it's important to make note of your patient's allergies. I'm going to push this back down to be able to see. Okay. I'm going to clean the area that I'm going to be using, which would be on the forearm, inner forearm, in a circular motion, working from the inside outward, and then allowing for the patient's skin to dry. Then I would carefully recap my needle, placing the cap always on a clean surface. I would recheck and make sure that I have my 0.1, which I do. So then with my non-dominant hand, I'm going to kind of stretch the skin out and inserting the needle about at a 5 to 15 degree angle, only about 1/8 of an inch under the patient's, or 1/8 of the needle into the patient's skin, with the bevel pointed upwards. So we should be able to see the tip of the needle. And then I'm going to inject slowly so that a small bevel forms, which it popped. the whole syringe and remove carefully. And then I would, without recapping, I would go and dispose of my needle, but I don't have a sharps container near me, so I'm going to recap with the scooping method, one hand. I would carefully dispose of my needle. Then I could dab at the patient's skin if there was any bleeding without wiping it or putting a band-aid on it. And then I would draw a circle around the bubble with my pen and instruct the patient that in 48 hours they need to go have it checked by their doctor. Take my gloves off, be sure to clean up my area, my needle is disposed of in a sharps container, wash my hands, ask the patient if there's anything else I can do for them, make sure they're comfortable, have everything they need, call 8 within reach, and leave the room.